Y'all, welcome back to the Healthy Sex Podcast. We are in the studio today with Dr. Erin Westner. We're so glad to have you here, Erin.
Thanks for having me, Carissa.
Yes, we are recording episode 25 of the Healthy Sex Podcast at the end of 2025, and we're going to make it practical and kind of juicy for y'all today. So a few disclaimers as we get going. Dr. Westner and I are going to be talking about various sexual positions and the function they serve for both male and female partners today. So a few disclaimers as y'all are listening. A lot of my audience tends to listen on Apple and Spotify and a lot of audio, but Erin and I are going to be using a lot of diagrams today. So if you can tune in on YouTube, this will be up as a video recording on YouTube, the full podcast, and so that might be helpful just because you and I are going to be talking through different positions and the physics of positions, etc. You've brought some models of the pelvic floor and genitalia that we're going to try and use for the audience to track with. A lot of people, we just want this to be very educational, y'all. And a lot of the education is going to be with a visual diagram or model today. So if you want to tune in on YouTube, for the audio people, you'll probably find that a little more helpful than trying to imagine things as you listen on Apple and Spotify. You can try, but
it's going to be a little bit different to like kind of put that all together.
Yes. So that's disclaimer 1. Disclaimer 2, why did I want to record this episode? I have a lot of clients and a lot of people that are very curious about exploring different ways of experiencing pleasure with their partner, but they're not sure where to go that doesn't harm their spirit. So I share throughout this podcast that this is we love Jesus, we love the Holy Spirit. We want this to be helpful and healthy, but also honoring to your soul and your spirit. So my heart is that this episode is helpful and practical for people who don't necessarily want to look at things like pornography, etc., for their point of reference or education. Not that porn is helpful anyway for any of that, but that's kind of the heart behind why I felt
a lot of fakeness in that.
A lot of fakeness and dysmorphia that comes from all that. But so that's the heart behind this episode, y'all, is a lot of people are curious and they're not sure where to go. So just as a Christian sex therapist, it's very important to me that Christians or people who don't enjoy pornography have a place to go for education. A few other disclaimers. Not all of this content may feel relevant, okay? So Erin, you and I have kind of mapped this out categorically about as it relates to different issues. So the first kind of frame that we're working in is orthopedic concerns and maybe some pregnancy concerns.
Yeah, I think that's an easy way to transition into like, okay, here are like the basic positions. And orthopedically talking, it's a little easier than going straight to like genitalia conditions.
Yes.
I think that'll be a good, easy way to kind of work into that.
Perfect. So that's going to be our first category, y'all. Then we're going to move into talking about pain with intercourse, probably primarily for the female. And then we're going to talk about some male sexual dysfunction, erectile dysfunction, maybe pain with intercourse for men. You have some models of the male genitalia we're going to use. And then we're going to move into talking about anorgasmia, particularly for ladies, and how to help women achieve orgasm. And then we're going to finish with talking about intimacy and pleasure and more of a sense of closeness in your lovemaking experience. So again, big picture as y'all are listening, if you're not too concerned about orthopedic issues, but you want to get to like sensual lovemaking, maybe consider scrolling ahead to towards the end of this podcast.
Yeah, I think that's fair.
Okay.
Although I will say, like, you will be talking more about the positions initially during orthopedic. So like that kind of tails into what we're going to be talking about later. But
I agree, but the attention span of Americans right now is less than that of a goldfish. So because it used to be 7 minutes, the adult attention span, it's far. I mean, now it's like when you're creating reels, it's like you got 10 seconds to grab their attention. If there's not boobs involved or a short skirt or something, you can't keep this. So that's just kind of what I'm playing off of.
That's fair.
But yes, it would be wise to listen to the whole thing, of course. What else, y'all? Another this is a selfish self-promo. January 24th, I want the listeners to be aware that there will be a couples workshop being hosted here in Chattanooga, Tennessee at Oaks Coffee House. I am putting on a 4-hour workshop for couples regarding communication and emotional regulation. That you'll find out is also a part of great sex. So if you want to come and participate, that's January 24th, 9:30 to 1:30. You can find that on my website if you want to sign up for you and your partner. But that's going to be happening in the new year, and we want to give you tools for you and your partner to just be able to enjoy day-to-day life, as well as possibly your intimate life more deliberately. All right. Awesome. So let's get into it. Dr. Erin Westner is the owner of the Pelvic Method here in Chattanooga. And Erin, you were just recently voted top 5 physical therapy practices in the Hamilton County.
Hamilton County. Yeah. So that was really cool. So it's based off of Google reviews and like just like the amount of rapport in like the community. And I'm really just grateful to be here and to be serving this community that way. So
well, congratulations.
Thank you.
Yes, you deserve that. All of the people I've referred your way love, and are so thankful for literally the life transforming work that you do with your patients. So thank you.
Yes, thank
That's
you.
awesome. Well deserved. All right, y'all. Another disclaimer we're sharing on the screen here. 4 things that I just want to mention. The first thing is a woman's pleasure is just as important as a man's.
Absolutely.
Okay. So the fact that we even have to say this is kind of frustrating, but it's true. All across the globe, it is unfortunate that the majority of male-female partners, oftentimes the male's pleasure is prioritized over the female. So as Erin and I are walking through the models with y'all in the position conversation, we want you to hear that this is to encourage pleasure for both the male and the female involved. Okay. Second, penetration is not essential for a good sex life.
That is absolutely true.
Okay. Third, pleasure is paramount and sex is not solely for the purpose of reproduction. And 4, sex is not the only form of intimacy.
Those are great rules.
Amen. All right. So that's what we're operating from today, y'all. All right. So we're just going to start, if you're watching online, so big picture, I've started with the missionary position, okay, which is husband on top or male on top. And as we're kind of getting this conversation, we just want to mention that if you were to research the Kama Sutra, which is like a Hindu manual for lovemaking and pleasure seeking, etc., and intimacy, some people would say there are like over 100 ways to perform penetrative sex with your partner and create pleasure. Some of my grad school professors would say there are 8 basic positions. Y'all, it's going to be impossible for us to cover it all today, but we're just going to try and give you from a position of probably 8 to 10 basic positions, and then how you can maybe tweak things and work within those positions to kind of create
and work with your own body types and even ailments. Like if you have something going on, how to tweak these positions to make them work for you.
Excellent. Okay. So the reason I'm starting the video with missionary is because I think most people just when they think of sex, they think men on top, woman on bottom.
Yeah.
And that was just my way of getting this conversation started.
That's totally fair.
Okay. All right. Also, woman on top, straddling legs. That's another common position, but we're kind of starting just with the format of lying down one with another and different options from lying down. All right. So let's get going and use our local expert here, Dr. Westner, and start talking about orthopedic and pregnancy concerns.
Yeah. So let's start orthopedic wise. So one thing that if we're going into positions and practicalities, the low back pain is probably the biggest thing that affects the majority of people at some time or another in their life.
Okay.
So that's one that I wanted to kind of touch on because if you're having low back pain, or like kind of consistent, or like maybe sex is causing some low back pain.
There you go.
There are some positions that can be easier for you, and it's just again like I said, one of the most common conditions, and these positions are specifically designed to kind of help support whichever partner, the male or the female partner, that might be having some pain. So you can kind of pick and choose certain ones that might make it easier for you.
Okay. Shall I show the diagram?
Yeah.
Okay.
Show me the diagram.
Oh, whoops.
Wrong one.
We'll come back to that.
Come back to that.
Okay.
But yeah, so these are some just general positions. And if we're thinking of like this has the woman's position and the man's position on these diagrams, and you can kind of go, there's more of these, and what she was saying with like there's variations of the same position.
Right.
So the reason we're talking about this today is because like the first 3 are man on top.
Okay.
But man on top, but with different leg positions or back supported for the female on a couch.
Okay.
And then sometimes let's say the first position, if the man is having back pain, being up on his arms having that back arched
Okay.
is going to cause more tension in
Yes.
that low back pain.
Right.
Or in that low back, sorry.
Yeah.
And can cause like, muscle spasms
Yes.
or can increase some tension that way.
Okay.
So this is not going to be a good position for a man that has pain. But if
Gotcha.
the female is having back pain, great position because she's
Gotcha.
relaxed in that back.
Okay, so let's review. I'm going to reflect back as you're sharing. So if the female's having lower back pain, the idea is if her male partner takes the more dominant or on top position, that's probably going to be better for her.
Correct.
Okay, and ladies, we want you to hear when your partner's on top, there are fun different ways that you can move your legs around. So some ladies prop their knees up. Some ladies wrap their legs around their partner's lower back or their glutes. Some ladies lay with their legs down and wider or more narrow. So when I'm working with couples and they really enjoy that position, I'll say, well, I want the female to kind of play around with like your leg position and just notice what feels good in terms of penetration, your back, blood flow, a lot of, and we'll talk about this with the anorgasmia, but women taking a more active role in that position, even though they're kind of in the inferior.
Yeah.
As far as like maybe
Even
grabbing
on the underneath.
Yeah.
Or
Yeah. So like grabbing your partner's glutes, pulling him in a way that feels good for your genitalia, etc. Maybe sitting up a little, like curving your body up so you can create more genital blood flow.
Yeah. Rocking with the penetration, things like that. Yeah.
Okay. Awesome.
Yeah.
Okay.
So there's ways to ways to make these work for you.
Okay.
And then the other thing is like, so either or both partners have back pain. The one that's where they're both kneeling.
Okay.
So not standing, because if you're standing,
So we're looking at the supported kneeling.
Supported kneeling.
Okay.
Or even just like in the supported with back on chair for the
Okay.
female. If you can kind of see, yes, thank
Sure.
you. I'm
Yep.
pointing at this one.
You're good. No.
But yeah, so those positions are going to be helpful for both parties that might have some issues.
Okay.
Right.
Yep.
We're getting to be less flexible as we
Age or Americans sit a lot.
Yeah.
A lot of people are struggling with weight.
Yes,
Yeah.
exactly.
So all of that influences our back.
Exactly. And so, or hips or whatever it is. So being on your knees actually shortens the hamstrings. We can reduce the strain on the back.
Nice.
And that can kind of help in those positions. So if we're looking at these positions with those are both shortening the hamstrings, and then you can either, this one is where the female partner is facing away.
Okay.
But if you're looking at the supported chair one, that's offloading both back a little bit there.
Okay.
And you actually have the female facing your partner. Okay. So there's variations in that and how you can make things more intimate, which is what we're going to talk about later, but how you can make things more intimate or sometimes they like, being not facing their partner because of insecurities potentially.
Sure.
And so then they like
Sure.
to
A lot
be
of ladies feel exposed in that.
in that position. So so those are some variations. And then so the next page,
Okay.
you'll see more variations of like seated position, woman on top versus man on top.
Oh,
sorry.
Sorry.
So if you're looking at the first few, first two is the female on top. Like
Also known as reverse cowgirl.
Yes.
We can have fun with that. Okay.
We can. And you can do reverse in this seated position too, which is so fun for people. Yes, there you go. The original picture.
Yes.
This is a great way for partners to kind of like hold on to each other and to support each other. But it's also great for like back and hip pain, things like that. So, so just moving on through some of these positions. Side lying is a great one for like somebody who has hip pain.
Okay.
So if you're side lying on the side that you have hip pain.
Okay. So let's say I have hip pain in my right hip. Okay.
As long as it's not the outside of the hip, like bursitis. If you're laying on that side, it will shorten the muscles of the hip. And, I don't have the hip necessarily,
but
that's right.
You can grab your model anyway. Y'all, so Erin's going to grab a pelvic floor model. So for those of you listening and not watching, she's putting out a model here to show us how the hip muscles pull on pelvic floor.
I'm going to grab the female model just because it's easier to see the hip. So this is the hip socket here. And there are pelvic floor muscles that go around and attach.
That camera can see.
Yeah.
Okay.
So.
Either way.
I can bring it up here
There
too.
you go. Yep.
So the So the hip muscles attach to the pelvic floor, and they wrap around and attach into the hip socket. So the hip kind of sits in there like the ball and joint.
Okay.
It is. And
this is the vulva, just for those of you watching to kind of orient. So the vulva or the vagina are down here.
And then you have the rectum back here.
Okay.
So you're kind of orienting front and then back.
Yep.
And then this hip sits like this.
Okay.
So if we're thinking putting pressure this direction on this hip and on this side of the pelvis. So if they're laying down, these pelvic floor muscles here on the inside will actually shorten and kind of release tension and allow for things to relax. If you're having any sort of front of the hip pain, like hip impingement syndrome, or like even like some like SI glute stuff, will
a lot of that. Okay.
So SI pain, glute pain, that will all shorten that side.
Okay.
Now, if you're having bursitis, that's directly on the ball.
Right. That's more the
hip.
bone.
That's more on the bone. It's the pouch of fluid. That gets inflamed. That sits against the bone.
Okay.
So that pouch of fluid needs to be on the other side.
Got it.
Like you need to lay off of that.
Got it.
So that if you're having bursitis, so that's kind of like the orthopedic conditions. Like when you're sideline, you can actually make things a little bit easier for you.
So I want you all to hear this because this is a fun position for a lot of people. So if the male's on top on his knees, or even standing on the edge of the bed, and the woman's laying on her side, you can flip it to right hip, left hip, and kind of go back and forth where you're laying on your side. That can be very pleasurable and fun, and visually stimulating for both.
Absolutely. And just like more access to other things, which we'll get into a little bit later, but so like you have access to other areas of pleasure. And I think that's really important when choosing sex positions too.
What feels good to both.
Yes.
I love it. Thank you, ma'am.
You're welcome.
Okay. Pregnancy. Can we talk just a little bit about pregnancy stuff?
Yeah.
Okay.
So this is like, person dependent too. So, but you can't lay on your stomach. As a female.
Right. You can. It'd be a little roly-poly-oly.
It'd be difficult. Especially later on in the pregnancy.
Yes.
And I think that's more what I'm talking about is more like that third trimester where you really can't lay on your stomach unless you have a pregnancy pillow.
Right.
That literally has a cutout for your belly. So for pregnancy, if you're thinking can't be on my belly, but you can be like on all fours, or you can be like leaning. Like I think we had those positions. You can be side lying, which is a really wonderful position.
Like this one, the spooning.
The spooning one is wonderful.
Let's talk about that for a sec. How do people accomplish that?
So female wise, like it's easier to kind of like open legs up first to allow partner to enter, and then you can kind of relax the leg back down.
Got it. Okay.
Just because sometimes like angles and your partner's angles and your partner's body will dictate how easy this is necessarily.
Okay.
But so the partner has to be kind of down a little bit further.
The husband or the male partner.
The male
behind.
partner needs to be down further so that the penis can get into the vaginal canal.
Okay.
You can have knees bent up as far as you want or not as far as you want. So like you can have those knees variation. And it makes the hip angle different. So like if they're having uncomfortable sensations with depth, you can reduce, and I say bring the hips more straight versus bending the knees up and having the hips bent up too. Okay. That will allow for deeper penetration.
What will?
If you bring the knees up.
Got it. Okay.
Towards your chest. So like if you're doing more.
So that's shortening the vaginal canal.
So
is that shortening the vaginal canal?
It's tightening the pelvic floor.
Okay.
In some ways, but you're still relaxing the pelvic floor because you're side lying.
Got it.
So it's not really like doing. It's helping blood flow to the pelvic floor from a relaxed standpoint.
Okay.
For all intents and purposes, but it allows the penis to get in deeper into the vaginal.
Gotcha.
And disclaimer here, your partner is not going to
say this for people because many people they don't know this answer.
The male partner is not going to hit the baby. And especially with arousal, like if you're working on arousal beforehand, the uterus actually does move up, even still with pregnancy, even though the baby is sitting a little bit lower in the pelvis. It is, and the cervix is closed. So penis is not going to be hitting directly to baby, and baby's not going to see
the
penis coming. I've heard that before.
Yes. Did you ever see the movie? Was it 9 Months with Hugh Grant and Julianne Moore?
I did, yes.
And they get pregnant, and they're like, one night she's trying to seduce him.
Yeah.
And he like freaks out. He's like, no. What if he's gonna see it? Or maybe they freak out and they're like, and they go to the OB-GYN.
Yes. It's coming at him. And it's just like,
I think a lot of people are like, can it see what's going on?
No.
Yeah.
It cannot.
Good.
Cervix is closed until you're actually getting ready to deliver baby, and then the cervix opens up.
I love it.
And even still, the baby is in a fluid-filled sac and very well protected and squishy in there, and it's just floating around.
Yes.
So at the very least, it's actually rocking the baby to sleep.
Got it.
So
that's cool.
The baby is usually inactive. During intercourse.
Oh, interesting.
Because of that movement and the rocking.
It's very soothing.
It's very soothing. So the baby actually falls asleep for the most part during that activity.
So sex is good for everybody.
It's great. Everybody's just relaxed.
Excellent.
Yeah. So I would just say, like, for the most part, yes, that sentiment, you don't have to worry about that.
Cool.
And fun fact about pregnancy is that you are a lot more lubricated in general.
The woman is.
Okay. Is constantly lubricated to keep bacteria away from baby.
Fascinating.
So she's usually, and there are some exceptions with some pain because like sensitivity of the vaginal canal too, because there's so much blood flow. Sometimes there can be pain.
Yep.
And that's why side lying is really great for the pregnant woman, because up on all fours can be a little bit tightening to the pelvic floor. But if most of the time for a female partner, sex feels great.
Excellent.
Because it is lubricated, blood flow is just...
And hopefully hormones are helping with your drive. And
usually helping with drive. Yes. Usually the killer to drive is like they just don't feel sexy.
Yeah. Or they're vomiting a lot and nauseous.
Yeah, that too. That can really kill.
Yeah.
That can really kill a vibe.
I want to throw up. Let's not have sex right now.
Correct.
Thank you.
There are hierarchy of needs.
Yes.
Before sex.
Yes. Some people need to hear that too. So thank you for that disclaimer.
Yes.
You believe it or not, you will not die if you don't have sex all the time.
Correct.
Yes. It may suck, but you're not going to die. Correct. All right, love. Thank you. All right, y'all, let's move on and talk about pain with intercourse. And again, we're going to talk a lot about the vagina here and maybe pain. I think you correct me if I'm wrong, but as far as what presents in my office, I hear a lot more ladies complain about pain with intercourse than I hear men. But because of your practice, that might not be the same.
I guess it's a little different. It's skewed because I do see the men that I see are usually having pain.
Okay. Yeah.
So a lot of times it's after even vasectomies. A lot of times because of like scar tissue and things like that. Pain with ejaculation or pain with erection. Those kind of things can occur.
Okay.
But yes, female pain is probably more predominant. Predominant in the grand scheme of things.
Okay. So let's start there. Yeah. Is that cool? So let's say we have a vaginismus case where there's spasming with the vaginal walls or diasporenia or vulvodynia. What are your go-to positions that you can think of, Erin, for a couple when there's pain with intercourse?
Well, letting the female lead is vital.
Okay.
Because that person can control the depth, they can control the speed, and they can control like how their body is positioning to help their pelvic floor relax in that state. So there's a couple different areas of pain with intercourse. So and I'll touch on a couple of them that you mentioned. So vestibulitis and vaginismus. Vulvodynia. Vulvodynia and vestibulitis are both all on the outside. Yeah. So like if we're looking at, as she mentioned before, the outer layer here is going to be your vulva. Inside is the vagina. And that's when you get vaginismus is inside.
So that's when like a penis or a dildo or whatever couples are using for penetration, once it's inside the vaginal canal, the vagina kind of spasms and is like, no sir.
Yes.
Okay. Okay.
Vulvodynia, it kind of encompasses all of the pain that's on the outside. So you can have pain
in the labia.
You can have pain on the outside, like muscular.
Yeah.
You can have clitoral pain.
Yes.
You can have different variations of that.
Yep.
Vestibulitis is a very specific pain, and it's based off of the nerves and even hormones.
Sure.
Because this is the fascinating thing about, and I'll geek out a little bit on this.
Yeah.
If you're okay, let me do
Totally.
this.
Yeah.
But the vestibule is just on the inside. So if you think about the vestibule of your home, okay, so the vestibule of your home when you walk in the door is the foyer.
Okay.
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 So we're talking about the foyer of your vagina.
Okay.
Right now.
Yep.
So like the labia, you spread the labia apart.
Yep.
Right on the inside of that is your vestibule.
And I'm going to jump in here and say that's actually very testosterone responsive.
Correct. That's what I was going to say.
Oh, sorry.
Yeah,
But
you're okay.
when couples that I'm coaching around pleasuring, this is a very underrated part of being able to stimulate with your hands, with tongue, with a toy, with the head of the penis. That can be a fantastically erogenous.
Yeah. And that's actually, which when we go into that, like I'll talk about the different variations of orgasms and stuff like that when we talk about pleasure.
Okay.
But yeah, so this is highly testosterone based.
Okay.
More testosterone based than it is estrogen based. Inside and outside of that area is estrogen. So like if you're having pain or having difficulty inside the vagina with dryness or irritation or things like that, that's estrogen.
Yep.
But if you're having more external issues, that's testosterone.
So also a caveat, this is why, ladies, it's so important for y'all to have your hormones balanced. And if you've not been keeping up with most recent research and publications, they're finding now that hormone replacement therapy is actually totally safe. They've removed the black box warning against cancer, et cetera, around all that.
Estrogen cream is wonderful.
Yes, estrogen cream. Some women use a testosterone, et cetera. So if your hormones are imbalanced, your vulva and your vagina are going to tell you about it.
Correct.
Yes, so we could do a whole podcast on that. But this is why you need to hear hormone balance matters across the lifespan. And one of my clients said, Erin changed my life, blah, 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 and talked about how hormonal birth control will dry this up for women and make those lips like thin and papery and like scratchy.
Because it reduces your natural production.
Correct.
So it actually shuts down. So birth control, what it does is it in a very, very simplistic view, is it pretends like you're pregnant.
Yep.
And it will shut down your hormone production.
Yes.
And not allow you to ovulate and not allow you to go through the natural process.
I'm hurting just thinking about it. Yes.
The natural process is what your body is supposed to go through in order for all the tissues to be healthy as well. It directly affects that tissue.
Yep.
And you can see it and what I call de-estrogenized tissue is a whiteness, like a very pale pink, and it just doesn't look happy. Like if you it looks kind of like deflated in the vulva, almost like a deflated balloon.
Yep.
And very pale.
So we want like plump and pink
and bright and like and
come on
glistening.
Come on,
it needs to be glistening.
Glistening.
Yes,
that is going to be a T-shirt. I want my vagina to glisten. Oh my gosh. We're going to get so many comments just on that. That's amazing. Cheers.
But yeah, so that's kind of like what we're looking for there. But and that can be like, so those external factors are different than what we would address a lot of the internal stuff too.
Yes. Okay, so pain with intercourse. Back
with pain and pain. Back to the original discussion.
Yes.
Penetration wise, if a female is able to control the speed of which the penis enters the vagina.
Yep.
And
can't remember.
Yeah.
Here we go.
Yeah.
Yeah. This is woman on top.
Woman on top.
Woman on top, for example.
And if the legs, so we're thinking like the hips here again, if you close the legs, because the adductors, the inner thigh muscles, actually directly connect to this line here, which are these muscles at the opening.
Okay.
If they are shortened, again, we talked about the shortening of the position relaxes those pelvic floor muscles.
Yep.
So any position that you can get to go close the legs for a female can actually really help. So this is why missionary position is missionary position with legs apart.
Can be painful.
Be very painful for women who have these vulvodynias and vestibulitis. Issues.
So the idea is if y'all are wanting to enjoy that position, try to bring your thighs in a little closer.
Correct.
And you and I talked about if y'all are comfortable with this and you and your partner feel comfortable with this, woman flipping over on her abdomen and having partner enter the vagina from behind on her belly and keeping her legs more closed. That can be fun for the male partner as far as friction and having the glutes kind of pressed into his pelvis, but also for the female not feeling pain as well.
Yeah. And if you do have pillows up underneath your abdomen, so your abdominal muscles connect to the pelvic floor as well. So like if you even support yourself with pressure of pillows up underneath of you, it also angles your hips and pelvis in a good way to relax your pelvic floor, but it also reduces pressure on the pelvic floor.
Yes.
So that is a wonderful way to, if you're comfortable in having communication.
Hey, you got to talk to your partner and tell them what you like.
Exactly.
Yes.
If you're having good communication and the trust is built there and like understanding, and then that forward facing downward with your butt up is going to feel wonderful for both you and your partner.
Yeah. Side note on that, it's fun. You know, I'm a psychology nerd, obviously, but I talk with my clients about temperament and personality. The Enneagram, if you want to nerd out, they talk about how different Enneagram types like different positions and like why they like those positions. So for example, 3s are like achievers and go-getters, and 3 females often, and this isn't, you know, I'm just speaking in generalities, but 3 females, because they finally just are like, here, take the lead. They really like the bent over, maybe on all fours or on their belly or standing at a counter or whatever position, because it's like, I'm tired of leading.
Correct.
Here, you take the lead.
Especially like I think in like a sexual experience too, like they are so controlling and everything else, and you can't control things to have pleasure.
Girl, come on. Yes. So just another layer to consider, y'all, is your personality is going to naturally play out in your bedroom experience in terms of what you prefer and why. And the more you understand that, the more you're going to be able to communicate that with your partner and understand like why you have certain go-to positions that you might really enjoy with each other. Ma'am, can we look at the O-nuts and talk about controlling penetration while we're talking about pain with intercourse?
Great idea.
Okay, so y'all, for those listening, Erin has more fun tools in her toolkit we're going to talk about.
More props. I apologize for the phallic nature, but we are talking about phallic stuff, so
you don't have to apologize. We're celebrating penises here.
We are. So here is what we call an O-nut. So I'm going to kind of separate them here. So they're stackable silicone rings. Okay. And I'll kind of like bring this up a little bit so that we can see. Yeah. So these little guys have like a good amount of pressure to them, so they can kind of wrap around the penis as if like pelvic floor muscles would. Okay. And they're soft, squishy, so it does have that sensation. And so what you would do is
you hold this up.
Yeah, if you don't mind.
Erect penis, y'all. Here we go.
And an erect penis, you would then put the O-nut on over it. And what happens is that controls the depth
of penetration.
So this is for somebody who has the vaginismus. So we're talking deep penetration issues. So these are people that have hysterectomy, where the vaginal canal is shortened and they hit something, or they have PCOS and they have cysts on their ovaries and the depth, like or they have fibroids, things like that on their uterus.
Cancer
survivors, yes, all scar tissue built up from C-sections, even, which is totally crazy. But yeah, so that depth can really impede their pleasure because it's going to be painful. Yes. So what this does ultimately, and I'll kind of go here, is that if you go in to the vagina, it stops you. It can't go any further. Yes. Now, these are stackable and they come in 4s. So not that I'm an...
And they can also be color-coded. I think you and I did a presentation together a few years ago for cancer survivors. We talk about all the colors of the rainbow. Just to make it
You
fun.
could make it fun. Yes. So here we have the 2. So like you've shortened the penis here. Your partner is still getting that restriction and that feel. And so they're still going to be getting that gripping feeling. So this is a wonderful way to increase pleasure for both your partner and for you without having that pain.
What I've heard people appreciate about this is a few things. One, because the husband or the male partner genuinely wants to just enjoy maybe active thrusting.
Correct.
And if he's so worried about hurting her, he's so like that anxiety or fear will shut his sexual function down. So this kind of takes that away, that pressure of I have to be really mindful and I have to be careful of how far in I go, etc. So this is kind of like taking a level or a layer of like pressure off of the male. And then some men, some of men are just really endowed. And so like, it's just not going to work for any human body for the length of their penis. And so,
and typically what I end up finding out, just by happenstance, not really happenstance, I ask, but my people who have pain are always with the well-endowed people. And I'm like, how did you,
y'all,
how does this keep happening?
But we can't do a show and tell ahead of time. Be like, is this going to work?
No, we can't. But ultimately, there are ways to arrange your body, arrange things, or use props. Basically, I would call that a prop. Tools to help support you and your partner.
I love it.
So that you feel a little bit more freed.
Yes.
Because again, it's that level of control. If you have to feel like you're controlling things, then it
really kills arousal. Yep.
So you have to allow your brain to feel sensations.
Yes, but also just relax.
And relax.
So y'all, please hear, I've shared this in other episodes. In order to get turned on and stay turned on, you have to have some level of relaxation because your genitals need blood flow, and that only happens when we're relaxed.
Correct.
Okay. Beautiful. Hey. Thank you, ma'am. Here we go. Another one for pain with intercourse. I shared this just because with some of my couples in our training, we talk about non-demand touching. So this is like the idea is if a couple's sitting in a tub or on the bed or on a couch or a floor, etc., the female is in the front, and this gives opportunity for her male partner to maybe stimulate breasts, nipples, the clitoris, inner thighs, etc., as well as penetration. And this can feel, like you were saying earlier, controlling depth of penetration, but this can be helpful for non-demand pleasuring and engage more of the erogenous zones for the female.
I love that, yeah.
Yeah, and again, it's intimate, it's close, but you can enjoy more parts of the body to kind of create and stimulate arousal.
Yeah, I like that.
Okay. All right. We're doing great.
Well, did you want to talk about the male pelvic pain?
No, guys don't matter.
Yes.
My bad.
I like it.
Yes. All right. So shifting gears.
I will switch pelvises.
Okay. While you're shifting models, guys, I'm having more and more men come in to talk about this, which I'm so encouraged by because guys have issues too that they need help with.
So we're
talking about erectile dysfunction, premature ejaculation, and delayed ejaculation is kind of our male sexual dysfunctions to address.
Right.
Okay.
We kind of touched a little bit on the men having pain from having to try to control and things like that. That can actually cause pain.
Yeah.
So I do have men who have partners who have pain and they end up with erectile dysfunction or premature ejaculation, things like that. Hurry up, or not yet.
That's right.
So like the edging, I think is what they kind of the young kids call it these days. I don't even know.
Okay.
But yeah, that can actually cause some issues with.
I did not know that edging can cause issues.
Yeah, if you're continuously edging, it can cause issues with delayed ejaculation or pain with ejaculation.
Okay, so listeners, hear this, because edging is a thing where people are trying to naturally increase orgasmic explosive pleasure intensity. So the idea is you edge towards orgasm and climax, and then you dial it back, and then you edge, and then you dial it back. And so more and more people are trying to, it's almost like a tantric practice, but you're saying that could cause some damage.
Continuous. Like if that's all you're doing, you're not allowing for release to happen naturally when it needs to, that can cause dysfunction.
Interesting. Good to know.
Yeah.
Take note, listeners.
Same thing with females. Like if you're getting to the point, like if you're not having the orgasm, which we'll talk about with anorgasmia, you can create a congestive pelvic region. It's like 'cause all that arousal and all that
lymph
blood flow
and the blood flow
all sits there.
Yes.
And it doesn't release.
And it needs to go elsewhere.
It needs to go elsewhere.
Heard.
Yeah. So same with men.
Love it.
Cool. All
Okay.
right, moving on.
Yes, ma'am. That's good.
But yeah, so pain with intercourse for men, and premature ejaculation and erectile dysfunction doesn't necessarily have to coincide with pain,
Right.
but often it does.
Okay.
So it's usually erectile dysfunction can be because they have experienced pain with their erection or with their ejaculation, orgasm. And this can lead to tight pelvic floors, which then restricts blood flow to the penis, which is allowing for engorgement.
Yes.
So what I'm going to specifically speak about is tight pelvic floors more so with men than weak pelvic floors.
And so as she's about to hold up this model, y'all, I want you to hear that anxiety disorders, trauma, ongoing stress with your partner during sex, all of those things can create tight pelvic floors. I'm just throwing that in there because the mind, and you and I should mention the anticipatory response.
Yes.
Can I say that here?
Yeah, absolutely.
Our brain is actually the most powerful sex organ. And Erin and I are going to dialogue a little bit about as we go through this. There's a certain part of the brain. Did you say midbrain?
So yeah, it's like in the midbrain, where
somatosensory cortex.
Yes, thank you. I am not on it right now.
It's okay. Yeah, you're doing great.
But so the pelvic floor has volitional control. So, and that's within the back of our brain where all of our muscles, so like our biceps and like we control our movement of our arms, we control the movement of our legs. Yeah. The pelvic floor, we have the ability to say, hey, squeeze or release so I can pee, poop, things like that. It has that ability. But it also, and more prominently, is lighting up in research more in the somatosensory cortex that it's anticipatory. Yep. So you're thinking about doing an activity and it's moving towards that. So like, let's say you were like, oh, I need to jump. Sorry. Need to jump. I need to jump up to get this thing off the top shelf. Your pelvic floor has already turned on as you said, oh, I need to jump.
Or where we see this in sex, especially if it's like, oh, it hurt last time. Tighten up, muscle guard, protect, because we don't want pain.
Exactly. So it's going to anticipate pain.
Yes.
Only one experience of pain can create this. And that pain
dun,
I know, it's terrible.
It really sucks.
It sucks. Because that pain could just not even be from sex even.
Right.
It could be from a
dehydration, a UTI, a yeast infection,
anything. A yeast infection. Even like a tear with pooping.
Sure.
Like it's like you can have like an anal fissure and like that will tighten up the pelvic floor muscles and cause pain elsewhere. So
men, we because I have more and more guys coming in going, I didn't realize how relational my penis is. And they're basically exploring and understanding, oh my gosh, I can't let go with my partner because of all of these things in my background, all the background noise from the experiences I've had with sex or with my partner. I didn't realize it was so connected to how my penis is showing up or not, or how I can't let go with orgasm or not. So
absolutely,
y'all just need to hear that. Your brain is like so powerful in this process.
It's going to literally control 90% of this.
Okay. All right.
So, but yes, so in that sense, tight pelvic floor. So if we're looking at this, like, so we have the penis here, we have the testicular sacs through here. So, and then you can see this is actually the red that you see here is actually muscle. So that's actually part of the spermatic cord, and it like pulls up. So this is the cremaster muscle.
Okay.
And that is the one that's more of an autonomic too. So like they walk in cold water, but also anxiety lift up. So that can also cause some tightness through here. But then if you're looking at, this is called the bulbospongiosis, not that you really need to know all these things, but the bulbospongiosis here is what allows for a partial erection to occur. So some men will say, well, I can get a partial but the rest of it doesn't fill up.
Right.
And that can be because you have necessarily strong pelvic floor. So the pelvic floor is working, but it's too tight. It's not allowing blood flow to come through. So that's really interesting there. So the blood flow comes up through top, and that can also be from anything in the abdominal cavity too.
Yeah.
So if you're tightening your abs a ton, that can restrict the blood flow to the penis as well.
Your lower back, or your glutes are tight, right? All that stuff.
All of those things are connected. This is a whole body experience to your pelvic floor.
Yeah.
And stating this from women and men, that a lot of the genitalia, so even like the tip of the penis, is actually coming more from like your lumbar spine.
Yeah.
And so for men, the tip of the penis and some of like some of the base of the penis a little bit too, and some of the erogenous zone off to the side of the penis, like the base, it's actually coming from higher up in the back. So like if we're looking at the nervous system,
the shaft?
It actually from the shaft. Yes, it's coming up from the lower back here, but it's actually the top of the lower back.
This is why back rubs are so awesome.
Yes.
This is why we need to scratch backs, rub backs, massage backs. This is why it allows everything to relax.
And even like, and I know this is really personal dependent, but like even like abdominal, like touching the abdominals to get those to release. But I mean, if it's going to make you tighten up, don't. But, but yeah, so like kind of like just like being around that area. So another like erogenous zone is right here on the hip.
Yes.
Right here, like grabbing the edge of
delicious.
the hip bone. It's a
delicious.
Wonderful spot. And why is that? It's because of those nerves coming across, and they're very superficial right here, that go straight to the genitalia.
I didn't know that.
Yeah.
That's why hips are so sexy for men and women.
So there's a nerve called genitofemoral nerve, and the femoral nerve comes from the back, and it wraps around and goes through the front of the thigh. And inner thigh, which is why the inner thigh is so nice. Yeah, so like
y'all, we're learning so much good stuff.
All
Let's
connected
go
to the genitals.
Yay! The center of our world. No, just kidding. That's good. That's awesome.
This is how we created the world. Yeah, anyway.
That's right.
Yes.
Oh my gosh.
But so if you're thinking about that, like if you are having back pain, which is why orthopedic stuff is so concerning, then that is going to directly impact what's going on down below as well.
Wow. Gorgeous.
I can keep going on.
I know.
About this, but
I know.
We'll kind of release.
If
this,
y'all need to, if you're struggling, you need to reach out to Dr. Westner, and she'll come. You go and see her, and she'll teach you all the things about your body and how to make it work.
I start talking really fast too.
I love it.
But yeah, so in general, one of the things for both male and female for pain with intercourse, one of the things I wanted to touch on is like a simple, helpful tool is to, when you're doing foreplay, because again, the foreplay is so important. It is not just about penis to vagina, but like to get that area functioning well and relaxed, you can also massage these muscles or release these pelvic floor muscles to allow blood flow.
Are these behind the testes? Or?
So if you actually lift the testes up and kind of get into, so these are the testes here. You're underneath the testes, and you can kind of like push gently.
Is that the perineum?
Perineal area.
Yeah. People call that the taint, y'all, if you need slang, but it's called the perineal.
The other.
Yeah. Between
word, but
between that and the rectum.
Between that and the rectum. Yeah. So that area, and off to the side, a little bit of the base.
Okay.
You can kind of like even just stretch the base of the penis a little bit, just kind of put a little pressure in and kind of pull to one side and pull to the other side.
So that's why men enjoy that so much.
Right.
Fascinating.
Yes. It relaxes pelvic floor, allows blood flow.
Love it.
And then, so that while you're doing other stimulation will really help that person who potentially is having like tight pelvic floor issues or pain. It'll reduce their pain, and it'll allow for erectile function to work a little bit better. And then for female, same thing. Okay. You can go to the outside where it's not so danger seeking for most of them is on the outside of their, let me grab the female pelvis so you can kind of see this. So, if we're looking at the female, like coming in from this angle on the outside of the labia. So like if we think the labia are here, outside of the labia, and just kind of like gently pushing in gently and releasing. Yeah, that does feel good. While you're doing anything.
I'll do that after the gym and my hamstrings are tight.
Yes.
Yeah. When your hamstrings are tight, they're pulling on everything, and you feel like, for ladies, like that your bladder gets tight. Yeah. And you just are like, why is this so, I just need a big deep release. And I don't mean sexually. I mean like the muscles are like, please give me some, that makes sense.
Yeah. So
I love
your
that.
inner thighs attached through here and your hamstrings attached through here. So like if you're kind of releasing that,
Love it.
or working on that, massaging
Girl,
inner thighs,
yes.
that will relax your pelvic floor, allow for blood flow.
I know
reduce
some people
pain.
use like a tennis ball or lacrosse ball to kind of roll around.
Yeah, you can do that in non-sexual ways too.
Yeah.
But
Cool.
like during sex,
Genius.
you can, during the
I love it. The
pleasure
foreplay.
yes, you can do that.
All right. Speaking of pleasure, let's move on to anorgasmia. All right.
The lack of pleasure.
The lack of not being able to access.
Yeah.
All right, y'all. So again, all the things that Erin and I are talking about, there are a lot of different reasons why you could be experiencing this. We're just kind of giving you a real brief teaser and overview. But anorgasmia is the inability to achieve climax or orgasm. Okay. So I'll start. In our sex therapy training, we talked about for ladies who are experiencing, when I'm coaching women who haven't orgasmed or having a hard time orgasm, we talk about wanting to be on top. Like you were saying earlier, the female gets to control her body, her movement. She gets to engage her pelvic floor a lot more. And this is fascinating psychologically because, especially in the faith community, a lot of girls and women are taught you can't enjoy your own body and you can't enjoy your own pleasure or you a hoe. It's true. And so, which is really sad. In fact, I've traveled and done mission work in other countries, third world countries, where there's female genital mutilation. And you're like, Chris, this is going dark. But the idea is across cultures, it is taught that a woman who enjoys pleasure is a dangerous woman. She's not controllable. She might not be faithful. So somehow, it's true.
I know.
In our culture, we're taught if you enjoy pleasure, you might be a hoe. You're not going to be faithful, blah, blah, blah. So across the lifespan of women all over the globe, I think this has been honestly demonic. I'm just going to use that language as a Christian. It's a demonic thing because in Scripture, in the Song of Solomon, the woman is the sexual aggressor. And the church does not teach this, but the homeboy, the husband, starts by adoring her verbally from head to toe. And she is so turned on by how he adores her beauty from head to toe that she's like, that's it. I got to have you. We're doing this now. And she becomes a pursuer because of how he loves on her and dotes on her verbally. That's on purpose.
That's part of the communication.
But that's also part of the beautiful gender play because most men want to feel wanted and they love a turned on woman.
Correct.
And most women want to feel adored. And when they feel adored and safe, then they want to offer their bodies and their version of their female feminine beauty and energy. So for ladies, a lot of the time when we're coaching them, at least for me in my practice, we have to coach them in all those other areas. Is you have to tune into your erotic energy. You have to tune into the part of you that is maybe selfish about your own pleasure, and you have to be okay with that. And like come to terms with maybe that's an okay, good, blessed thing. Does that make sense?
That makes total sense.
So how that plays out then is if I believe that, then I'm going to feel permission to go after my pleasure when I'm with my partner. And for example, this position that we have on the screen now is if a female's on top, she gets to control the movement, the humping, etc., do the work. Women can go up and down here, side to side, and there's a 90-degree angle to work with here where you're sitting up or you're leaning in, and
you can change
kissing.
Yeah, you can even change the way that your hips are. Like so, you can even have one leg up and one leg back a little, like, or like on your kneeling, and then one leg up in like a lunge position.
Yes, or some women squat.
Yes,
they do a squat.
I'm like, that's an endurance activity.
Yes, that's why the gym is helpful, y'all. That's another episode. But keep your thighs in shape so you can do this. So again, forward or backward, forward or facing or backward, depending on what you're comfortable with your partner. But we also want gravity to work. So I have some couples that are like, coach us through how to have better oral sex. If oral sex is important, you and I talked about this when we were talking about this podcast, Erin, laying on your back as a woman, the blood pools away from the genitals. So ladies, we want you in a position where gravity is working in your favor. So when you're on top, gravity is helping flow into that part of your genitals. If you're pursuing oral sex, the idea of you and your partner finding positions where maybe your vulva is over top of him in some capacity, forward, facing backward, whatever you're comfortable with, side lying. But if you're interested in the oral sex component as part of foreplay or part of instead of penetrative sex, consider positions where your genitals are over top, and you can use that gravity for your benefit.
I love that.
Okay,
that's great.
All right, I mentioned that.
Well, the other part of anorgasmia, which we kind of touched on this a little bit, where you mentioned the vulva, like the testosterone base, where we have those that sensation, that very large sensation. the first third of the pelvic floor for a female vagina is the external genitalia, and that comes from like the tailbone, glute, sacral region.
Okay.
So if you're wanting even better, so we talked about like back rubs.
Yes.
Is great, but glutes, like if you're grabbing glutes, if you're like having your partner on your sacrum, stimulating the tailbone area,
could be massaging, caressing,
like like kind of
teasing
touch. Yes. Even if it's like different temperatures, things like that, playing with those things around those areas while you're doing your foreplay or while you're actually engaging in penetrative sex, that is going to increase the external genitalia, so your clitoris, and your first third, so that vaginal opening.
Yes.
And there are different types of orgasms.
Yeah.
And
Go
for
ahead.
women,
Yeah.
yes. Okay.
Let's briefly touch on that because we got to get to
other things.
Yes.
But there are different types of orgasms in different areas of where women orgasm. So the clitoral orgasm is one we think of, but the vaginal opening is another orgasm. Then there's the G spot of the female, and then there's the cervical. So like the cervix actually can contract and create a large, or the cervix, the uterus is part of the cervix there, and it can contract and create a deeper orgasm. So various types of orgasms, various intensities. So just because you're not getting the one, you are still getting orgasms potentially in other areas. Yeah. And that's important. Regardless of where the orgasm is coming from, all orgasms matter.
Yes. Yes, they do. And if you are struggling with orgasm, please come see Dr. Westner or myself, because it could be psychological, it could be relational, or a sense of safety and trust and not being able to let go.
Yes.
And it could be a tight or weak pelvic floor.
Correct.
And or hormone imbalance.
Yes.
So again, this is all so layered, but I just want y'all to hear things to consider if you're struggling reaching climax. Okay. This is another one I shared from Dr. This is a book that I recommend for people who just want Christian literature, Celebration of Sex. It's a red cover with gold lettering by Dr. Douglas Rosenau. He was a supervisor of mine. He's since passed, but he was one of the OG Christian sex therapists worldwide. And this is from his book, The Celebration of Sex. He has 8 basic positions for people to explore here. But the idea is, this is scissors, and this can be fun for, we call this Sunday afternoon sex, like lazy sex. Yeah, so it's like we're relaxed and we just kind of roll over to each other.
Yeah.
And husband enters in, like you were saying earlier, from a little lower position, but he's also able to access her clitoris. Her breast play. She's able to love on him, grab a hold of him, et cetera, et cetera.
I don't call that lazy sex. I feel like that's pretty involved.
No, do you?
Like, okay. I mean, just in general, because you can do a lot of things.
It's true.
In that position.
Yeah.
So,
maybe lazy is not as active or athletic.
Yeah, it's not as athletic, I guess.
Does that make sense? It's more like
you're not
sensual
using the thighs and squatting, doing lunges on your partner.
Let's go. I love it. All are welcome.
Yes.
That's so funny. All right, y'all. So we're going to wrap up this awesome podcast about positions that are more intimate or tantric. Okay, so this is a passion point for me. I think the good Lord designed sex between husband and wife to be this, along with all the other fun things we're talking about. But so much of our culture is missing this because it's so pornified and it's so genitally focused that we're missing the whole human, body, mind, soul, and spirit, but also just more of the body and more of that face-to-face connection. Like, as Americans, we are not doing well with just face-to-face connection.
I agree.
And that plays out in the bedroom. So we're going to talk about like actual intimate positions and tantric energy, which is taking it slower, more love-making energy instead of just wham bam, thank you ma'am, sir. Yes.
All right. Yeah. So we kind of touched on this from like a perspective of facing each other is easier, and then this is the woman. The man is.
Well, that's interesting. That's not the one I wanted.
No.
Let me see if I can find it. Nope, can't. But we're going to re-describe this. So in theory, the woman would be on top.
The woman would be on top, yes. And the woman is able to come down on the penis in this direction. But it is a very intimate, because you're
chest to chest.
Yeah, chest to chest, and your legs are wrapped around each other.
Yeah.
Which is a very I think, very soulful kind of
Yes.
feeling, because
Yes.
like you're trusting one another.
Yep, and it's
in that.
heart energy. You can kiss here. Okay, so this is sorry, I grabbed the wrong diagram. All right, but I want you to imagine the male is on the bottom and he's maybe seated, propped up against a solid headboard or a couch or a chair with good support, and then the female's on top, so she's actually wrapping her legs around his back, and then the idea is she gets to kind of control and slide back and forth or up and down, however y'all figure that out as a rhythm. The rhythm matters, obviously, for both. But again, that heart energy, the breast play we haven't talked much about, but breast play, if y'all are both comfortable with that, is actually really powerful for helping women get aroused, experience oxytocin, which is calming for the brain, and nipple stimulation can be very erotic for people as well to help reach climax. So there's more breast play available here. Kissing, again, breath, like your close proximity.
Yeah, and the interesting thing is, like, it's the same part of the brain as your genitalia, is where the breasts kind of light up as well. So it is a very erotic tissue. It is a sexual tissue for both male and female. And so something to kind of consider with that, like it can light up the genitalia in that direction too. So it's really
I love
cool.
it. The Lord's design is really cool.
Yeah,
I love it.
It's a full body experience.
It is. It is. All right, y'all. So this position, this is husband or male partner standing on the edge of the bed, and female. We can talk through different leg positions here for the woman.
Yeah. So like, again, the depth of the penis is based on like how high your hips are going up towards your chest. So the closer your knees are to your chest, the deeper the penis can get. So if the depth of the penis matters for you, and you can get like more orgasm from like that uterine, like the hitting the cervix kind of thing, that's what you're going to want. If you're more of like, no, I need him to stay a little bit more for surface area because I feel more things at the opening, let me kind of push away from it, like have like that pressure up against him. And you can utilize your hips in this direction by like propping up on his hips. Like, I don't think you can see the heels kind of digging into the hips a little bit.
Yeah.
And you can use your body to kind of like go with the motion too, as well as not the partner being able to thrust as well. So I think this is a wonderful position.
Yeah. And men usually enjoy this because they can watch the vulva, the penis and the vulva, and they love that visually. I mean, that's what it says literally here in the book.
Oh yeah,
is the penis thrusting in and out. A lot of men love watching that.
They're visual.
Yeah, because sex is all five senses, right? So what am I visually able to enjoy? And then ladies, you're able to move your feet all over. If you want to put your feet on his chest, if you want to put
Shoulders.
your ankles up by his jaw. A lot of partners like kissing on their partner's ankles and toes. I mean, it can be all sorts of fun and sensual, but this can be a really fun.
Yeah, absolutely. And I think we've touched on that too, like the face and the connections there. When we were talking about this, we geeked out, but yeah, like even like the jaw connection to the pelvic floor. If you can kind of release the tension through there and create like a good support system, like so even if if your male partner maybe having like pain or something like that, even like bringing your leg up to their jaw and then kind of like really being able to do that would be great in this position.
Love it.
So the jaw, if that's tight and you're clenched with the jaw, your pelvic floor is not able to relax and open up and allow for the orgasm either. So.
Yeah. And this is a good position for guys who have erectile dysfunction because, again, they're using gravity to help keep the penis engaged and engorged as far as blood flow.
And something we didn't touch on when we kind of talked about, like, it is an athletic event, the things that help your pelvic floor be stronger. So like if a male is having pain or erectile dysfunction, if you're using your inner thighs, if you're using your glutes, all of those actually help the pelvic floor tighten. So keeping your legs strong, your core strong, that is going to be imperative in order the intensity of your orgasm and the ability to have erectile function.
The need for exercise and regular movement.
Absolutely.
I love it. Absolutely. Okay, y'all, I don't know what he's wearing here. A jock strap? I'm not sure.
I don't really understand that either. I was going to ask you that.
I don't know, but we're going to ignore that. Yeah, pretend he's not doing that with his whatever.
Whatever that is.
Yeah, okay, but from behind, again, for everyone's different about this. Some women I work with love this position, and some men love it, and some women I work with don't love it because it feels impersonal or they feel objectified. So this is, again, specific to you and your partner. In theory, y'all need to be able to talk about this and talk about if you're both consenting and cool with this position because this feels more vulnerable for the woman. But ladies can move, again, that 90-degree angle. It's like she's on all fours. She can come on down
Yes.
to the bed or the floor or the couch or whatever.
On elbows or all the way even flat. Yeah.
Yep. And different times of the month, this is going to feel
much different.
Yeah. Yep. So usually after menses, when things kind of reset, this can feel more painful than ovulation or closer to period.
Yeah, if you're thinking ovulation, you're actually a little bit more on the horny side, I guess. Anyway, just because that is when
testosterone spikes. Yep.
And you're ready to go because your body is looking for the semen.
Trying to get pregnant.
Yep. But that's what it was made for. But the pleasure of that, it does allow for that blood flow there for females too. And it's a great position, especially like I said, from arousal standpoint, even like that glute work and like touching the back and kind of like letting the man. So men, your job is not to just thrust there.
There you go.
Please touch and caress the back and the hips and the buttock area, the breast,
the clitoris.
Yeah. Yes. All of those things during this position. I think that's the important
coaching
part. Because that is what all of those nerves are connected to the genital. Yeah. Like at that point.
Yeah. So and I think it's important for men to hear that because porn this is a common position in porn, but it's used very abusively.
Correct.
And so we don't want it to be abusive energy. We don't want it to be unsafe energy or aggressive or harmful energy in that way. We want it to be like consensual and pleasurable for both people involved. Okay. Again, we talked about the scissors earlier. There are different ways that you can enjoy scissors, but this is more face-to-face contact. We're enjoying all parts of the body here. We haven't talked about standing up much.
No.
The Kama Sutra was big on this one.
Yeah. Well, and again, you're thinking like standing, you're utilizing your leg muscles too. So your pelvic floor is a little bit more active in standing.
Okay.
And so if we're having trouble orgasming or having trouble with erectile function, standing, again, that whole blood flow kind of releasing down towards there, but also because your pelvic floor is more active in this position too. Okay. So, so if you're having pain, not necessarily a great position because that's going to be hindering because you're tightening your pelvic floor. But if you're having anorgasmia, trying a standing position is a wonderful way to kind of work the pelvic floor a little bit harder to be able to reach that climax too. So
that's fascinating. And there, y'all, if you were to look up the Kama Sutra, they're going to have this position with 7 different variations. Lift this leg, lift that leg, wrap both of the female's legs around the partner's waist, etc. There are different ways to kind of enjoy the standing up positions. Anything you'd say to that?
I mean, that's with all positions, I think. Yeah, you can kind of move legs, hips, tweak things around to make it whatever is like just right for you. Like, play around with them.
Okay. And as we're wrapping up with the tantric intimate stuff, I'll just mention then, Erin, I'd love to hear your closing thoughts on that. Kissing. Not enough people kiss. Y'all, kissing is so important for your love life, a sense of connection, making sure you like how your partner kisses, making sure hygiene is prioritized, like brush your teeth, maybe floss, gargle, whatever you got to do, chew gum, have a mint, but like hygiene really matters, the way that you smell, the actual physical pheromone chemistry is real. And so like maybe you use body wash that's pleasant or shampoo or deodorant, whatever it is, but trying to make your senses pleasurable for you and your partner because the brain is experiencing all 5 senses. And when we get going in sex, our adrenaline kicks in. We shift over to a sympathetic nervous system, and then we start smelling things that maybe we didn't notice before. We start tasting things we didn't notice before. That's just present when adrenaline dumps. So just be mindful of hygiene and and your senses and kissing and face-to-face, especially deep kissing for women. I know during intercourse, women are more likely to accomplish orgasm if there's deep kissing going on.
Yes, and I mean, I can go on about that too, but there is a sphincteric control over the oral cavity and the pelvic floor cavity.
Girl.
Which
No
is
wonder you love the pelvic floor. It's connected to everything.
Everything.
Yes. Yeah.
Oh my goodness. I can like literally connect the pelvic floor. Like it was funny because somebody said something about shoulder pain like at a conference one time. And I said, well, I could probably connect that to why you're not having more.
This is like my big fat Greek wedding when he uses Windex on everything.
Yes.
You just need Windex. You just need to spray it with Windex.
You need your pelvic floor. You need your pelvic floor.
Exactly. Yes. Yes.
So yeah, so that oral, that connection between the oral, and we talk about that more in like the birth realm, because if you're open and like more, if you're like doing ahs or ohs, things like that, that low groan is super relaxing to the pelvic floor, and it opens up everything. So like,
I can literally feel it go through my pelvic floor.
So thinking, I know, it's crazy.
Yeah.
But feeling that vocalness in sex is super important.
Totally.
Because it's going to allow the release of that.
Thank you for saying that. Y'all got to talk. You got to make noises.
Yes. Be animalistic, I guess, a little bit.
Totally. Like, yes, it's supposed to be fun.
Yes.
Yeah, there's a primitive part to that God's designed that with. Like, it's just straight up biology.
Yeah.
And I have a lot more women saying, I don't want my partner to be quiet. Like a lot of men don't feel comfortable, well, men and women, but I'm just going to say this because this has been more recent. A lot of men don't feel comfortable making noise when they orgasm. Like it's expected that the female is supposed to like scream and holler and like just be, but men lock it down. And so I have more and more women saying, I want to know that I'm making you feel good.
Correct.
Could you please make noise when you climax too, please? Because I want to hear that you're feeling good and it turns me on and it makes me want to orgasm.
And I think, and I truly believe like, and that's where a lot of people like, they're like, we want to come together.
Totally.
Like we want to orgasm together.
Yes. Yeah.
And I'm like, well, then you guys have to like play off of each other.
That's
and
it,
like
girl.
if you're not expressing that you're getting close, and then that partner is like, oh, I'm doing this to this partner, to my husband, or I'm doing this to my wife. Like if you're not giving cues, then their arousal is going to be like,
oh, do you like this? Do you like me?
Do you want,
do you like what you're looking
do you
at?
want more? Like, do you want less?
Totally.
What do you want?
Yes.
And so, so that it is a part of your communication. So being, not being demanding, obviously, but like being like, oh yeah, like, yes, that, no, that, like, no, let's switch that up a
gentle
little bit.
Feedback
Gentle
if it's
feedback.
a no. Yes,
like, gentle if it's no.
That sucks. What are you doing?
This is horrible. Redo.
What were you thinking? Oh my gosh. No, I've had people that they're scarred because they have those kind of, so be gentle in giving each other feedback, but please give each other feedback.
Yeah. Yeah. And maybe, and I always like usually like, I use this with like other things, but like compliment sandwich, you know, that's feeling really good, but I think if we try a little something else, like maybe I can move my like body a little bit and then maybe that might feel a little bit better.
Yeah. Yeah.
Like, you can do a little bit of a compliment sandwich in that situation.
I love it. You're so funny. All right, y'all. Closing remarks as we're wrapping up this awesome episode. Thank you so much, Dr. Westner, for being here and your awesome brilliance and the work that you do and changing the lives of others and their love life for the better. Y'all, if you're listening to this podcast and you get some fun wild hair ideas on spicing it up with your partner, please don't blindside them with that. So many people come in hot and they're like, we're doing this. And the partner's like, wait, we never do this. What is this? Where's this coming from? Please try to communicate with your partner if you're interested in new positions, maybe that we've talked about. Feel free to blame us, but don't just come in and blindside your partner, because most people are like, where's this coming from? Most couples have a routine and a pattern, and so it can feel anxiety provoking if all of a sudden my partner comes at me and is like, I want to twist you around and do blah blah blah, and it's like, wait, did you watch this somewhere? Have you done this with someone else? And sometimes that we shoot ourselves in the it feels like it creates insecurity rather than fun and connection. So communicate if you're wanting to try new positions. Also consider different spaces and different times of day. Routine is the enemy here, y'all.
Yes.
So that's a CrossFit term, but it's true.
But scheduling something too is also kind of erotic in a way. So like you like know on like, okay, on Tuesday afternoon, both the kids are going to be gone and I'm going to like, we're going to do this. And then you kind of have like communication of like, I can't wait for later. Like having it a little bit scheduled can be very erotic. So it's,
for sure.
So yes, routine change. But also scheduling can be sexy.
Yes.
If you make it
scheduling
sexy.
Doesn't have to be routine. It
does not have to be routine. No.
Right? So that's the difference. Is I think people think it's routine.
Correct.
Like, oh, we have to plan for it.
Right.
That's different than the same thing all the time over and over again.
Yes. And the same position, the same
Right.
the same
Yeah.
set
Yeah.
up.
Yeah. We need some spice.
Yeah.
All right. Thank you so much, Erin, for all of your
Yeah.
wisdom today. This
Thank
was
you
awesome.
for having me. This is fun.
All right, y'all.
Always.
If you found this helpful, please leave us a review on Apple or Spotify, and please feel free to share it on your platforms, family and friends. We really appreciate you tuning in. Cheers to a healthy and blessed sex life.
Amen.
Thank you for listening to the Healthy Sex Podcast, hosted by Carissa Kay. If you're an Apple user, please leave us a review. And no matter where you're listening to the podcast at, please feel free to share it with your friends. You can find all of our conversations at thehealthysexpodcast.com.